everyone, welcome back to my channel. I know everywhere you go now, everywhere you turn is raining Nurses Week. So this is Nurses Week, and in the spirit of Nurses Week, I want to complete the series that we started sometime last year. That was November last year, and that series is on kidney. We talked about the symptoms of kidney infection, but I know some people actually want to know what are the causes of kidney infection. What are the things that can predispose one to have this kidney failure before you can talk about the symptoms? So this is what we're going to discuss in today's video. And if you've not watched the previous video that I talked about, you can check the link here. I will leave the link in the description so that you can click it and watch the video. And having said that, if you are new to my channel, you are highly welcome. And in order not to miss any videos that I put up, kindly hit the subscribe button and also the bell by the side. And let's go straight to our topic. I want us to talk about this because kidney failure doesn't just start like that. You can just start to, let's say, you can just say today that you just wake up and you have kidney infection. There are so many risk factors that can predispose you to this, and this is what we're going to talk about. And I'm going to be looking at a note that I made here so that I will not miss any of the points. So the first one is I'm going to talk about children. In children, there are some children that have diseases that can predispose them to have kidney infection. Number one, which I have managed personally when I was in school, is nephrotic syndrome. Is a disease of the kidney that affects mostly children. So when a child has nephrotic syndrome, and if not well managed, it can lead to chronic kidney failure. That is number one. Then another risk factor also is if you know that you are hypertensive, because in hypertension there is always a case of renal insufficiency and also renal function failure. So somebody that has hypertension is at risk of having kidney failure. So, and this is why every time you hear me telling you in my videos that you should always endeavor to go and check your blood pressure, to know the level of your blood pressure, so that it can be easily detected, or it can be early detected that you have hypertension. When you notice that you have hypertension and you start on time to treat it, then it will help you to avert other complications that comes from hypertension. Do you understand? Or if you know that any of your family members have hypertension, your mom, your dad, or anybody, then you need to keep an eye on your blood pressure to make sure that it doesn't exceed the normal range. The third thing that can predispose you to this is diabetes. People that have diabetes, they are at risk of developing kidney failure. So if you know that you don't know your blood glucose, as I'm talking to you now, you've never checked your blood glucose, you've never gone for a test called fasting blood sugar or fasting blood glucose, you don't know it, you don't even know your random levels, please, after watching this video, go to the nearest hospital and get your, oh Jesus, sorry, something just fell off from my table now. So if you know you don't know your blood glucose, after watching this video, please kindly go to the nearest hospital to check yourself and make sure that your values are okay. If your values are not okay, then see if you can receive some medications while you employ some lifestyle changes. Point number 4, sickle cell anemia. People with sickle cell, people that have sickle cell disease, people that are born with sickle cell, they are also at risk of developing kidney failure. This is a risk factor. It's not something that they did themselves, but it's a risk factor. And this does not mean that everybody that has sickle cell disease will end up with kidney infection, but it's a risk factor. Sometimes most of them ends up with that. Tip 5, inactive life. You need to keep active. People that are inactive, maybe because of the nature of their job or because of wherever they are, and they are inactive, if you are not always active, you are predisposing yourself to kidney infection. So when you are always active, it helps to give you the ideal weight that you need. In case if you are overweight, it helps to make your weight to be normal, and exercise also helps to manage your high blood pressure. Then the next risk factor is HIV and AIDS. This is because people living with HIV and AIDS have greater risk of developing renal failure. So it is very important that you identify your status on time and start treatment as soon as possible to avoid ravaging, nephropathy, and other renal failure symptoms. Risk factor number 7, reduce your salt intake. You need to reduce your salt intake. When I say reduce, you need to mark this word reduce. When we say that you should reduce your salt intake, it doesn't mean that you should remove eating of salt entirely from your meal, because your body still needs salt to function. Your body needs salt to transport some elements in your body. So your body needs salt. So what we say is that you should reduce the intake of your salt, especially if you know that you are hypertensive. You need to reduce your salt intake, and this is the way you can reduce your salt intake. The first thing is try as much as possible, if it is possible. That's why I said try. See if you can prepare the meals that you eat, so that you know the quantity of salt that you are adding to the meal. Then if you must eat outside, please check the leaflet that is always attached to food, and check the sodium. Sometimes they will not write sodium, they will just write sodium chloride. You need to check the levels to make sure that you are not taking higher quantity. Then also, if you are the one cooking your meals, then you should be mindful of the seasoning that you use, because some people will use seasoning cubes, salt, and other seasoning things to add to their meal. By so doing, you are adding much salt to your meal. So if you eat, whether you have hypertension or not, take a look at the salt that you take. It is very important, but don't stop entirely, because your body needs it to function. Point number 8, adequate fluid intake. And most of the fluid, the most appropriate fluid that we talk about is you should always take water. Always have water handy. Make sure you drink a lot of water. If you are thirsty, don't go for soft drink first. Just take water, enough water, and you get yourself back. So point 9, quit smoking. Please quit smoking. If you know you smoke, don't smoke. Then if you know you smoke, please quit it. It is for your own good. Forget, it's for your own health, it's for your own good, because when you smoke, you're also endangering yourself, because this will slow the blood flow to the kidneys, and it helps to slow the blood flow to the kidney, and when the blood flow to the kidney is reduced, it will definitely affect the function of your kidney. Point 10 is benign prostatic hyperplasia, condition known as benign prostatic hyperplasia. That is a condition that affects male. So when you have issue with your prostate, it can also predispose you to have kidney infections. Sometimes when you have cancer of the prostate, or issues that affect the prostate that already have affected the person's ability to urinate, or that have already caused changes in the urine of that person. When I did the symptoms of kidney failure, I talked about changes that you can see in your urine. And most people with benign prostatic hyperplasia, or even people with cancer of the prostate, sometimes they show most of the signs that I talked about. You can watch the video to know the signs and details, the changes that you can see in your urine, especially if you are a male. So if you are a male and you are advanced in age and you have benign prostatic hyperplasia, or you don't even know that you have this, but you are showing signs, there is changes in your urine, you are seeing blood in your urine, the quantity of urine that you produce is now lower than it used to be before, you cannot even reach the toilet before you urinate on yourself. If you see any of these symptoms, it's also a risk factor that you may have kidney failure, but this can only be detected when you go for test. Point 11, avoid too much intake of pain relief that you get over the counter. People are used to taking drugs or taking medicine that helps them to relieve pain. Once you feel headache, once you feel any particular pain, you just go over the counter to get any drug, to get any pain medication, and you see yourself injuring yourself even without knowing that. So if you feel any pain, the best thing to do is see your doctor, so that the cause of that pain can be identified before you start treatment. So avoid taking over the counter drugs. Then the final point also a risk factor also is that you need to get your kidney function test. You need to go and check your kidney function test and also your electrolytes, so that you can be able to say that you don't have any of these risk factors. Because I know some persons will say, all these risk factors that you mentioned, I don't think I have it. I don't think it even runs in my family. The only way to say that you are free from everything that I just mentioned here is for you to go and check your kidney function. Do you understand? The final one, pregnancy. Some women, you may not have all these things, but once you are pregnant, you start seeing yourself, you start showing all these signs of, there will be protein in your urine, your leg will start swelling and all these things. So pregnancy can predispose a woman to kidney failure when it is not properly managed. Guys, I hope that all these points that I mentioned is very clear to you. So I'm having said that, this will bring us to the end of this video. If you are new here, my name is Amara Uzodigwe, registered nurse midwife. I use this platform to share a lot of things with us. So if you're here to subscribe, kindly hit the subscribe button, share the videos, and also tell your friends all that you learned from this video by sharing it on your wall, in your WhatsApp status, or in anywhere that you think that your friends are in a better position to see, so that we all can go together and be healthy. Bye.